This learning module is the instructional component of the final report of the EDUC 4701 course, Teaching and Learning Instructional Design and Technology. It is designed to be implemented in a hospital hand hygiene education program involving healthcare employees in patient care. The topic in this presentation is how multi-drug resistant organisms is creating a need to improve hand hygiene practice in healthcare employees. The goal of this presentation is to increase awareness of MDROs and motivate healthcare employees to practice the proper hand hygiene techniques in preventing the spread of this organism in hospitalized patients. At the end of this learning module, there will be an online quiz to assess the knowledge of the learner and to assess the effectiveness of the instructional method. Practical assessments for proper hand hygiene practice would be performed at a later date during performance of regular patient care activities. Acquiring infections while receiving health care in Canada is a serious concern. This problem can be preventable and avoidable by simply changing how health care is administered. The Chief Public Health Officer of Canada reports that more than 200,000 patients acquired health care associated infections last year. 8,000 of these resulted in death. A contributor to this statistic is C. difficile infections, with mortality rates having tripled since 1997. Healthcare-associated methicillin-resistant Staph aureus infection rates has increased more than 1,000% from 1995 to 2009. About 80% of infections are spread by healthcare workers, patients, and visitors. Administering health care through proper hand hygiene practice can significantly reduce the spread of infection and thus prevent many deaths from occurring due to these problems mentioned. The first objective of this module will be to identify the basic features of multi-drug resistant organisms, from now on referred to as MDROs. Identifying which are the most common MDROs, and to identify where MDROs are found on patients and in hospital settings. The second objective is to identify how MDROs are acquired in hospitalized patients and the role proper hand hygiene can play in preventing the spread among patients. The third objective is to apply the appropriate hand hygiene method suitable for the certain working conditions in preventing the spread of MDROs between patients. And lastly, Objective 4 is to apply proper hand hygiene methods to meet the hospital compliance requirements. Let's begin with describing the basic features of MDROs. These two antibiotic sensitivity testing plates illustrate how sensitivity patterns are changing in microorganisms. On the left side is an example of a sensitivity test of E. coli, an organism normally found in the intestinal tract of humans. The large zone sizes of inhibition around the different antibiotic discs show that this strain is highly sensitive and any of these drugs can be used to treat an infection in the host. Overuse and misuse of antibiotics over the years has caused certain strains of E. coli to develop multi-drug resistance, illustrated in the plate on the right. The top 4 MDROs causing healthcare-associated infections according to the World Health Organization are methicillin-resistant Staph aureus, abbreviated as MRSA, Clostridium difficile linked to antibiotic-associated diarrhea, vancomycin-resistant Enterococcus, or VRE, and lastly, extended-spectrum beta-lactamase, or ESBL producers. The resistant strain of E. coli in the previous slide is an example of an ESBL producer. Most recently, some strains of ESBL producers have gone on to develop further resistance to newer carbapenem family drugs called CRE strains. Let's look at some key features of each MDRO. MRSAs are described as gram-positive cocci in clusters. That is, they stain blue when using the gram stain method and are usually seen in group formations resembling bunches of grapes under the microscope. Staphylococcus aureus can cause serious wound, respiratory, and blood infections. MRSA are broadly resistant to all penicillin and cephalosporin family of antibiotics, limiting the treatment to only a few drugs, one being vancomycin. C. difficile is a gram-positive bacilli, meaning that it is rod-shaped. It has the ability to produce spores, which can survive long periods of time on dry surfaces. It is important to note that alcohol-based hand rubs are ineffective in killing C. difficile spores. This organism is normally resistant to most antibiotics and therefore can thrive in the human gut during prolonged treatment with these drugs. Absence of normal bacteria in the colon allows C. difficile to release potent tissue-damaging toxins. VRE are gram-positive cocci in chain arrangements. Like MRSA, it is resistant to most antibiotics, but also including vancomycin, leaving the treatment of this organism with even more limited options. The fourth and last MDRO which will be discussed is the ESBL producer and the CRE strain of organisms. These organisms are described as gram-negative bacilli. That is, they are rod-shaped and stain red using the gram stain method. They contain encoded genetic material for antibiotic resistance that can easily be shared with other similar bacteria. All it takes is one ESBL producer or CRE strain to convert a population of nearby bacteria from being multi-drug sensitive to multi-drug resistant. Let's address the question, can healthy hosts carry MDRO without any symptoms? Healthy hosts can carry MDROs on the skin, in nasal passages, or rectal area without any symptoms. Specifically, MRSA can be carried in the nose, on hands, or in rectal area. C. difficile VRE and ESBL CRE can be carried on hands and in rectal areas. Next, let's discuss where in the hospital environment MDROs can be found. Basically, on any contaminated surface, including bed rails, telephones, call buttons, tabs, door handle mattresses, and chairs. If the microbiology lab isolates an MDRO from a patient sample, the infection control practitioner and patient's ward is notified immediately. The patient will be put in isolation while in hospital, and a thorough decontamination of the room will be required after discharge. Culture testing will be performed to assure that the room is completely MDRO free. The source of MDRO infections in hospitalized patients is primarily by healthcare workers through person-to-person touch. The healthcare environment, including hospital equipment, is another source. Some types of infection-causing bacteria can survive on surfaces for long periods of time, for many weeks and even months. The World Health Organization identifies 5 moments for hand hygiene practice in preventing the spread of infection-causing microorganisms among patients. The first moment of hand hygiene practice is before touching a patient. second moment is before performing clean aseptic procedures. The third moment is after body fluid exposure risk. The fourth moment is after touching a patient. And the fifth moment is after touching patient surroundings. Selecting the appropriate hand hygiene method depends on which technique is most practical, efficient, and effective under the appropriate condition. Strategically locating alcohol-based hand pumps is one essential component to successful hand hygiene practice. Proper technique is the other, making sure that a pump full of product is applied using thorough rubbing motion in every direction 20 to 30 seconds. If hands are soiled, the appropriate technique is using soap and water in the steps summarized in the poster. Gloves are required when performing sterile techniques such as changing wound dressings, or if there is risk to exposure of blood or body fluids which potentially may contain HIV and hepatitis-causing virus. These posters, reminders, aids are located throughout the hospital and should be reviewed periodically. Part of an effective method of preventing the spread of MDROs is maintaining a comprehensive hospital hand hygiene policy. This would include proper initial education, yearly reviews, and continuous practice compliance monitoring. Visible poster reminders would be distributed throughout the hospital. Alcohol-based hand pumps would be strategically located for maximum use. The best reminders of proper hand hygiene to clinical staff are those that come from vigilant patients, and this should be welcomed and encouraged. Improvement in use of proper hand hygiene methods cannot be assured without measuring knowledge and practice behavior of healthcare employees. Knowledge will be measured by completing the online quiz immediately after this module, and participation in yearly review will be part of the hospital hand hygiene program. The quiz can be repeated as many times as needed until all the answers are completed correctly. At a later date, you will be observed while performing your routine patient care duties for the application of proper hand hygiene methods. This will be performed by a trained observer using a checklist assessment tool. Feedback will be provided immediately after assessment. Any incorrect observations will require a repeated assessment. A pass will be recorded after both assessments are completed successfully. Data accumulated through the hospital hand hygiene program will be analyzed on a yearly basis, and improvements will be recommended accordingly by the Hand Hygiene Program Committee. In summary, proper hand hygiene can significantly reduce the spread of healthcare-associated infections. Rates of multi-drug resistant organisms are increasing at an alarming rate, and thus, as a result, the risks of injury and death this may cause to hospitalized patients. By completing the objectives of this module, the learner will be more aware of MDROs and educated in proper hand hygiene techniques. The learner will better appreciate the importance of participating in online training, doing quizzes to measure learning outcomes, and periodically being audited for compliance. The healthcare employee will be more accepting of hospital policies regarding hand hygiene and play an active role in improving ways in preventing the spread of infections among patients. Following this module will be an online quiz. It can be repeated as many times as required to answer all the questions correctly. Thank you for your attention and participation.